We are coming to you live from SAPS training in St. George. And so we are broadcasting this for all of our attendees to see as well. And we were trying to hook into Dixie's really nice tech system, but we can't figure it out. So that's okay. My laptop will work. I hope everyone is doing well. Just a few reminders, we won't have the UPCA webinar next month because hopefully we'll be seeing most of you guys in beautiful Bryce Canyon at our Bryce Canyon Coalition Summit. We are recording today's call, so if anyone wants to go back later and watch it or share it with coworkers, we will send this recording out after we're done with the presentation. We do have Logan Reed and Jordan Mathis planned or scheduled to present on the opioid settlement funding, which will be very exciting for all of us to learn about. But we've had some policy issues come up in the last few days. And so Richard Nance is actually on the webinar to introduce us to what's happening with the nicotine content rule. And then Susanna has got some tips for us. And then we'll turn the time over to Logan and Jordan to tell us more about the opioid settlement funding. And just a reminder, please visit the attendance sheet in the chat and let us know if you're here. We do keep track of attendance. So without further ado, I'll turn the time over to Richard. Thanks so much, Richard.
Okay. So I think we were all kind of happy toward the end of the legislative session when we heard that the nicotine content rule for vaping liquid was gonna survive at 3 milligrams. I heard yesterday from Art Brown that, and everybody probably knew this as well, that the tobacco industry sued the state over this rule. And we thought, yeah, big deal, who cares? Well, the word I've gotten through Art is that the state health department has decided to settle this lawsuit rather than defend it. And they basically caved in and accepted the 5 milligram nicotine level that the industry wanted. And as far as I know, we're not getting anything else out of that. It's just that we've health departments caved in. So I see on here that we've got tobacco. Let's see, I'm on the wrong page here.
The tobacco team.
Yeah, tobacco team. So I'm really interested to hear if they have heard anything. But I think we need to talk about what we should do as the prevention group to fight back to keep this from happening. I don't know if it's a done deal or not yet, but Art and I have both started to make some contacts with folks, and I think Susanna may have done that too, because I talked to her about it yesterday briefly. But Art has contacted a couple of kind of deep pocket public health advocates who have good relationships with the governor's office, and started to let them know what's going on with this and asking for their help. I have spoken to Senator Kennedy, who's the Senate chair of the Health and Human Services Committee, and sent an email message to Ken Ivory, who's the chair of the House Health and Human Services Committee. Let's see. I also have a call into Doug Thomas at Intermountain Healthcare to chat with him about this to see what he knows. But we have put so much time and effort into this that it just really pisses me off that health department leadership has caved on this. I can say that because I don't work for anybody anymore, so I don't give a crap. I don't really want to pull any punches or be diplomatic about this. This just really aggravates me that I believe the head of the health department is basically just decided it's not worth the effort and who cares, independent of what her subordinate folks have told her. And so anyway, I don't know. Jordan's got his hand up, so maybe he knows something I don't.
Yeah, I don't think what you're saying is completely accurate.
It
In
doesn't
our
surprise me at
discussion.
all. I just barely heard yesterday, so please. Like,
There's other things at play, including procedurally. We could have, as a system, improved the process for how the rule was put into place. And that's the thing that's being challenged and probably won't stick. And so, looking back at it, from my understanding, is it's really kind of a technicality type deal. We should have done a better job in putting things in place when we got the rule in place, because those are the things being challenged and probably will lose. And that's why it's going to more of a settlement, not because they're weak. It's just because we didn't do things the way that they needed to be done, and those things are legitimately being challenged, and therefore settlement's probably the easier route, because you can fight it, but you're probably still going to lose on a technicality.
Jordan,
That's my understanding.
Jordan, can you hear me okay?
Yep.
Okay, is there any, so with them settling, is it going up to 5%? And is there anything that we as community members can do to push back on at least that, bring it back to 3 in a proper way that won't be a technicality, or is it just a done deal?
I don't know. They're working on, my understanding is the settlement is to get, they're getting some draft language for the rule change as part of this settlement. And until I see that, I don't know that I can, would have to see what that rule change, what the language all entails, but it is moving it to 5%.
I think the most disappointing thing is that almost everyone on this call during the legislative session or during the rule discussion wrote in or mobilized community members to talk about the concerns with the 3% versus the 5%. So I think that's why we feel as a group that we want to make sure that next time when things like this come up, we are following a rule so that we don't lose something in the technicality. Is that something that someone somewhere can show us that we did, that we can do better next time? Because I'm really frustrated with the idea, and I'm speaking of my own community, that we have vaping and e-cigarettes are being used for so much more, and with just having more stuff involved in our community.
And that opportunity is still going to be there. My understanding, the settlement is just agreeing to address the rule. The rule still has to go through that same, it has to go through the process. We're still going to have the opportunity to speak to the new rule. They're just getting the language put in place as part of the settlement to adjust the rule. So I think we'll still have that opportunity. So
that's really, I think, the question. This sounds like it's an administrative law judge sort of process. I mean, I don't know at all how this has been filed, how it's been filed, who it's been filed with, who's the decision maker on it. You know, if this goes back and the settlement is 5 milligrams, then we go back through the rulemaking process yet again, like we've done twice before already.
yeah.
All right, that's just kind of stupid, I guess. But like I said, I really don't care anymore.
Richard, the best advice I ever got: never apply logic to politics. That was from my poli-sci teacher. Don't do it. It's just pointless. You'll get upset. But if you have nothing else to share, I have one tip that for our policy and our policy work group advocacy that I was going to give to people at this point in time that could be generalized. So not just for this particular issue. What else do you have, Richard?
Okay, just so I understand what Jordan's saying, let me try to repeat it back to you. So the rule change won't be a permanent rule change. It'll be a recommendation to go back to 5 milligrams. I say back to 5 milligrams. Were we ever at 5 milligrams in the first place? Go back to 5 milligrams, and then there will be public comment on the rule process again, and the process itself will change a little bit to, I guess, meet the whatever the technical requirements are to do it properly. Is that right? More or less?
Yeah, the rule will have to be changed to adjust to what the settlement or what they're agreeing to. And my understanding is they're just agreeing to put language into the rule. The issues around the technicality were with regards to consideration for fiscal impact. And my understanding is during that process, there wasn't, even though there was submissions with regards to potential fiscal impacts of moving to 3%, those were not documented and put in, and there was a zero fiscal impact noted by the department. And so this is my remembrance of the conversation. They probably just won't win on that. And the fact that there was submissions of what the fiscal impact would be, and yet the fiscal impact noted by the department when they posted the rule was zero. And so that's really the holdup there, that we as a state didn't appropriately address what the fiscal impact of going to a 3% would be. And so that's the issue. And so in order to do so, they're going back, they will draft it. They are agreeing as part of the agreement that they will draft it at 5%. And then something to do with how the FDA is moving forward with approving it, looking at those type of things. I did ask, and I don't know if I ever got an answer to a question, if the FDA comes in, and starts approving things at 5%, there is a lot of preemption in tobacco, whether or not that preempts us in general. Like, can we be more strict than what the FDA is approving? If they're approving things at 5%, can the state really come in and I don't know that I ever got the answer to that question, whether we'd be preempted on those type of things. But I'm seeing things in the chat, but I don't know if it's for me. But anyhow, it's very confusing, and part of the reason I was never a fan of the FDA ever getting involved with regulating tobacco in the first place.
Yeah, the tobacco lobby is probably as big as the firearms lobby back in Washington. So, you know, if it goes to the House of Representatives to set a 5% rule, I think we're probably screwed at the national level. And as far as whether we as a state can set something more conservative, I guess that depends on the federal regulations, because if you think about the BAC level for DUIs, the national standard is 8%, but us in Colorado have a 0.05 standard, which is more conservative than the federal standard. Anyway, I appreciate that. You're filling us all in, Jordan. I just had no clue, but the earlier you can find out what's going on, the earlier you've got a chance to run some interference. Mikkel, hi. Looks like she's got her hand up.
Yeah, I just had a question for Jordan. When you say fiscal impact, are you meaning the retailers specifically? Like the retailers had a pretty negative fiscal impact because they weren't able to sell their products because of the 3% rule that we were enforcing? Is that what you mean?
That's my understanding, is they submitted and said, this is the amount of product that we'd have to basically lose by going to a 3%. But they have an opportunity to submit what the fiscal impact of the policy would be. And they submitted something, and we still, when the rule was submitted, noted a 0 fiscal impact. So by we, I mean the state. So that's my understanding of one of the areas being challenged.
So, oh, sorry.
Go ahead.
So in the future, just trying to think of like what this would look like if we were to readdress this again, we would address the fiscal impact for retailers more thoroughly. And like, is there anything else? Like, is there a list or things? I feel like some of us are newer to this area. And so I feel like having specific things of like, this is what we need to address next time to cover all our bases.
So Mikkel, what I think, because I'm looking at the time too, and I want to give Jordan and Logan time to talk about that. But what I'm going to do, so in case someone knows, I'm supposed to be working on your policy. So I will work with Jordan and maybe Bryce Sherwood to find some things to send to this group. I will also work with them to identify kind of like the outcomes of what it means for the community. So you have those bullet points to share with your coalition or retailers so that they're clear on what the law is and where they're at right now. So that's what we'll do moving forward. And I just want to make sure that we give a little bit more time to them, because I'm going to give you one action item this month. I would like everyone to find out who is on your board of health for your counties. That's your task for this month. Just, you don't have to do anything else right now, but you want to know who they are, what their roles are. Like I found out, like we have a county commissioner obviously on them, what it is they're doing. So that's your goal for this month, is getting to know who they are as we move forward, because they are also people that may govern your like mental health facilities or local substance abuse authorities, as well as your health departments. So find out who's on there, and we'll talk about that next month. So I want to turn the time back over to Heidi, Jordan. And thank you, Richard.
Yeah, thank you, Richard. Thank you, Susanna. Thanks for all the great questions, you guys. Let's turn the time over to Logan and Jordan to tell us more about this opioid settlement funding.
Thanks, Jordan, for filling me in.
Well, and actually, Heidi, are you seeing the pyramid now?
Yes. Uh-huh.
I just wanted to point out that this is actually a perfect conversation, because as Heidi mentioned, we have a group of students going through the prevention skills training right now, and we've been spending a lot of time talking about this pyramid from the Institutes of Medicine, talking about how we should be spending our time and efforts if we want to prevent problem behaviors. And you see that the biggest part of that is the primordial prevention policies that affect health. Like this is, I'm just saying, I guess that I'm I love hearing these conversations with these UPCA meetings, because this should be a big part of what we do, is targeting policies that have an influence on health. So that's kind of the perfect segue into us talking about what's happening with the opioid settlement. And I know that there are some people on this call that this is going to sound kind of like a broken record to, because you've heard parts of this presentation numerous times, but Heidi asked if we would come and just give some background and some information on what's happened with the opioid settlement dollars. And as I've been trying to do every time we talk about this, I just want to give a lot of credit, a big thank you to Director Mathis. He hates it when I call him that, but Jordan has put forth a lot of time and effort into helping us push prevention, making prevention a priority with what happens with these opioid dollars. And so I think it's exciting when somebody in a director's position like he is really steps up and points to the research that shows we need to be doing more prevention, we need to be doing more primary prevention. So can be pretty informal. If you have questions, we're happy to ask, but I think that our objective here is just to give you the background on what has happened to try to push opioid settlement dollars toward prevention. And this really started with Jordan getting a group of people together to submit some proposals and see how we could push for this funding to get down to the local level to do primary prevention services. So Jordan, I'm going to let you jump in and I can fill in wherever you want me to, but do you want to just kind of give us some background on the original intention here and what's happened with these funds?
Yeah, I mean, the short of it is, as we looked at the data, is the current model that we're operating on. Do you want to go to the current model that we're operating on? Right there. That's the current model we're operating on. Is that the majority of the resources actually go to the tertiary prevention, and the smallest portion of the pyramid is the primordial prevention and the primary prevention. And so it's completely out of whack. In this current model, I don't know if we had slides that actually showed opioid uses, but it's very clear that it's not working. It's not working the way that we need it to work. We're never going to get upstream with the current model. So the proposal was that this opioid settlement dollars give us a great opportunity for us to start that shift. And you want to jump back to the current model one? Sorry, Logan, if you click the next one. So, right there. Okay. So this is our proposed model. How do we get back to this? How do we get back to what the research says that we should be doing? And if you go to the next slide, it should show us that, right? So the idea is over an 18-year settlement, and the settlement being front-loaded pretty heavily with dollars, as that you make this gradual shift. And it was pretty simple math as we looked at it. It said, if you started with a 70-30, right? If you started where we're kind of at somewhat in our different areas, with only 30% of the resources going to prevention and 70% of them going to treatment. If we just start there saying we are in an acute crisis where we need to be able to get those individuals who become addicted to opioids off those, and over time we make this gradual shift of 2.5%. All you do is shift it 2.5% every year. This is the graph that you get. So you still front load it. Treatment's still getting, when we look at total dollars over the settlement, treatment's still getting more than prevention. but we're moving gradually to a model that flips that pyramid from where it's at to where it needs to be. And we're moving more and more people out of treatment. We're doing a better job in our communities with regards to prevention. And if you'll, Logan, go 2 more. Oh, so the primary prevention, this is 2.5% increase. I don't remember exactly what this is, but I want the next slide is the one that I want. And the idea is this: we do nobody a favor who goes through treatment when we discharge them into a community that has the same risk factors and lack of protective factors that got them to where they are at. So we've got to do a better job of providing that so that when an individual does go into treatment, that there's places in that community that has low risk factors, high protective factors, and that they're not going to take the path of least resistance and go right back into their addiction. So this is the concept. Like, we gotta, as we move upstream, we have this, we've got to quit looking at treatment and prevention as separate things. They've got to work together towards, in our utopian society, all of us, we would love it if there was no need for treatment. We're always going to have a need for treatment. What we've got to do is create communities where that need for treatment is a lot smaller than it is right now. And so in doing so, we've got to have an integrated framework for how we work together and how that treatment works in conjunction with prevention to provide this. So this is kind of the model, and doing that, taking that shift and moving it that direction was the overall concept. Logan, do you want me to address that we didn't quite get to even our ideal ask?
Yeah, which I think that was the difference between these 2 slides. This is what we were proposing. This is more what we got. So do you want to talk about that a little?
Yeah, we didn't even get this. I mean, we asked for them to give us a few years of growth. We wanted to say, give us halfway through the settlement. Let us show our worth to you. Just grow the pot by 2.5% over the course of half of the settlement, and we'll come back and we'll show you some results. They basically said, okay, we'll give you 3 years. We'll give you 3 years and we'll see what you can do, and you can come back. And what I want to be clear with is they're not expecting results like all of a sudden this big swing in opioid use is going down, but they need to see that we have active coalitions who are gathering data, who are looking at the risk and protective factors in their community and really starting to hammer away at those things. That's the things that we need, and that's the deliverables that we might be able to get in 3 years. So we didn't even get to where we wanted. We wanted to just say, give us a pilot. And they said, okay, we'll give you 3 years, which is better than nothing. And I think we can continue and ask for more and more if we can actually show that we're getting results. At the end of 3 years, in my view, what we need to be able to do is say, if you pull back on this funding, here's all the coalitions and active work that will go away if you pull back this funding. And we will never get to see what the ultimate outcome could be.
Yeah, and I think, I really love this diagram here that Jordan put together, because I think a lot of times in prevention, we've struggled to figure out how to connect prevention with treatment and recovery. And there's a lot of different ways that we can do that. But I think this is a really great one to point out that if somebody is in treatment, we need them going into healthy communities. As Jordan said, communities where risk factors are low and protective factors are high, so that they can be more successful with that treatment and with that recovery. And that's our goal here: increase protective factors, decrease risk factors. So to just give you a quick summary of what happened with the settlement, there are two different pots of funding. There was a portion of the settlement that went to the state. There was a portion that went to the county. Of that went to the state, they had about $6 million that they were going to allocate toward treatment, prevention, and recovery services. And so we were asking for about $2 of the $6 million at the state level that were getting allocated to treatment and prevention services, with, as Jordan mentioned, a 2.5% increase every year. So we're going to start around 2 million, but every year it will go up just a little bit so that we can get back to what the research shows we should be doing, which is putting more time, effort, and money into primary prevention. So as Jordan mentioned, the original intentions of the appropriation were to get that money dedicated to prevention at the local level, going through coalitions, so that we could do primary universal prevention at the local level with an increase in funding over time. We asked, here's the ask that we just talked about, that there would be that 2 million, a 2.5% increase, and that most of that would go down to the local level for coalition work. As Jordan mentioned, they gave us until 2026, January of 26, to come back and present to them some results. They want to see some form of outcome. So I just wanted to show you overall, these are the outcomes that they're looking for. They want to see opioid drug use going down, which we can look at the SHARPS data, hopefully as a benchmark to show whether or not we're reducing use rates. And they want to see all of the consequence data that surrounds opioid drug use going down as well. So fewer ER visits, fewer overdoses, fewer deaths, fewer arrests and incarcerations. But those are the long-term ultimate outcomes. We're talking about 10 or more years as we get toward the end of the settlement. What I was excited about is that the short-term outcomes that they asked us to show in these first 3 years is they want to see that we're increasing the number of coalitions that are working at the community level. They're doing readiness assessments to see how ready their communities are to address opioid use. And they're implementing programs and strategies and activities that are evidence-based and that will target drug use. And that's something that we can deliver on. We can get this money, we can increase services in our communities, we can build coalitions, we can push them through an evidence-based model. The law actually requires that we're using the communities that care model for this. And we can get coalitions targeting risk and protective factors. After that, the 3 to 9 year outcomes that they want to see changes on are those protective factors and risk factors. So as you know, we track a lot of different risk and protective factors on some of our data sets in Utah, but these are some specific ones that were picked that A, directly target drug use, specifically opioid drug use, and B, are very common in our communities throughout the state. So I think it would be easy for any community, any task force, any coalition to be able to find one of these risk or protective factors that is a priority for them in their community. And what they want to see is that over time, we're impacting these. We're reducing the risk factors, we're increasing the protective factors. So what happened is Jordan was able to get one of our policymakers that submitted a request for appropriations for the money to go toward these things. It was Representative Judkins in Utah County. That went through thanks to help from Jordan and a lot of you who got your coalitions active, your prevention staff active, and you contacted your policymakers and you expressed support for this. And so as a result, the appropriation went through. As Jordan mentioned, they didn't give us half of the settlement. They only gave us 3 years before we have to come back and ask for it again. But this is how the state is rolling it out. And they did a webinar last week for all of the local substance abuse authorities who are the ones eligible to apply for this funding. And these are the criteria. Each LSAA can apply for a base amount of $100,000. It has to be spent on primary prevention. It has to target coalition work, and it has to address some of these risk and protective factors that you see right there. It can be spent on personnel. It can be spent on evidence-based programming. It can be spent on environmental strategies as long as they target one of those risk and protective factors. And it can be spent on capacity building as long as it relates to any of those outcomes that I just showed you. In addition to that, LSAs can apply for another $150,000 on top of that. That one requires that they have a really detailed action plan that shows how they would use those funds in addition to the $100,000 they would get. And there's also going to be scoring based on if they have high overdose death rates in their community or a specific target population that is at higher risk for drug use. Most of this that I'm talking about right now is not really important. Like I said, your local substance use authorities have this information. They're going to be applying for the money. That money is going to get rolled out to coalitions to do primary prevention work. I think something that is the most important takeaway from this, at least for me, goes back to, I pulled this quote out of one of the publications that Dr. Hawkins and Catalano published back in 1992, where they were pointing to all of their research that says the most promising route to effective strategies for the prevention of adolescent alcohol and other drug problems is through a risk-focused approach, which requires the identification of risk factors for drug abuse, identification of methods by which risk factors have been effectively addressed, and application of these methods to appropriate high risk and general population. And what I take from this is that we need to identify the risk and protective factors that are prominent in our community, and we need to find a way to address those with a universal population, which is coalition work, doing primary prevention services in a specific locale. But remember, the results we have to show, the outcomes we have to report on, is a change in these specific risk and protective factors. And I think that one of the things that we failed to do a lot of the time in Utah, and when I say we, I mean me, in all the coalition work that I've done, one of the things that I've struggled to do is stick with the same risk and protective factor that I'm trying to address for a long period of time, which is what we have to do. If I actually want to see youth attitudes favorable to drug use go down in my community, I have to implement strategies that will change those attitudes, and I have to do it over and over again for an extended period of time until we can actually see that risk factor starting to go down on our SHARP survey or whatever baseline data we're using to address this. And so for me, that's one of the biggest takeaways here. As this money starts to roll out, as it starts to come to us at the local level to be targeted towards our coalitions, we have to be doing community readiness assessments to show that we know what our community is ready for. And we need to target these risk and protective factors for an extended period of time. So what I'm asking, I guess what I'm encouraging us to do, is to pick one of these risk or protective factors or a couple of them that are a problem in our community and hitting them hard for the next 3 years until we go back to the legislature to show them what we're doing. And then we're going to need to keep doing it for the next 5 years on top of that, so that by the time we get to that midway point, we can actually show them that we have decreased the risk factors and increased the protective factors. So it's one of the things I like about how this rolled out, is that it gives us the opportunity to show some outcomes, not just with use rates or not just with consequence data, but also looking at the root causes of the problem in our community. And I think that we have an opportunity to show some changes here if we'll stick with one for a while. Jordan, what else do you want to add to that?
I think the only thing I'd add is go back to the application for funds. Maybe the next one. There, that one. The counties that give a portion of their county allotted opioid settlement dollars to primary prevention. This was a big conversation, a big thing that we wanted as part of this request. We actually went in and said, we want you to require some skin in the game from the counties. And the reason we did that is we know that the tertiary prevention costs so much money, and it will gobble up all the county dollars very quickly. And so we wanted to be able to give local coalitions and LSAAs a tool that they could go to the counties and say, if we don't put a portion of our county dollars towards prevention, we're going to miss out on opportunity. So as coalitions, as you're working with your local county elected leaders, talk to them about this and make sure that they understand that if they're not willing to put some of their county opioid settlement dollars towards prevention, they'll be losing out on additional prevention dollars that could be coming to their community and helping you to get further and further upstream. This was purposefully put in there to assist you in being able to draw down those funds, and hopefully it will help you a little bit.
Yeah, I'm really glad that you brought that up. Think about, we had a little, it was over $6 million in the state side. It was $6 million that was going to go toward behavioral health services. That means there was that much and more on the county side. So our counties got a lot of money that could also go toward this if they are willing to do that. And so as Jordan said, if they don't put some of that money toward prevention, they're going to miss out on more than half of what would be available to them on the state side. And think about it from your perspective. You could get up to $250,000 in your area just from the state, and then add to that with whatever your county can be convinced to add in as well. So hopefully, as Jordan said, this will give us a little bit of a stick to go in and say, you need to put some of that county money towards primary prevention as well. Susanna?
One of the documents or the images that you showed that really helped get some buy-in from our directors and other partners in Weber and Morgan County is the document or the image that Jordan showed earlier about the, go back to the image. Do you know what I'm talking about? Thanks. That one. Go back. That one, the recovery model. So that was really helpful to show to our key partners that this is how it would play into supporting a healthier community and showing that common goal. So I really appreciated this particular image in my county and getting that buy-in from our county commissioners, our health departments, our sheriff department, because you are correct, Jordan, it would gobble up just a lot of stuff. What?
So Susanna, since you mentioned that, I'll just put a link to these slides in the chat box. So if anybody wants to go and access any of these images, you can do that. Ciara, I don't know if I'm saying that right.
Yeah, so I'm Sierra for those who may not know me, and I work for the Attorney General's office for the Utah Opioid Task Force. And so I'm coming from like a state perspective, and I put some links in the chat that talk about the Opioid Settlement Advisory Committee recommendations, which may be relevant to many of you, may not. But aside from that, I just was looking at the chat, and I know somebody had mentioned something, you know, are we targeting prescription opioids? And I just want to be clear that the settlement details are broad. And I think just a phrase to keep in mind is these dollars are intended to not supplant, you know, other projects, kind of like how tobacco dollars have went. And then the other phrase I want to keep in mind is just ameliorating the harms of the opioid crisis. So opioid abatement is what it actually says. So I think all of these conversations that you're having are opioid abatement. So I just want to be clear, it's not type of prescription or type of opioid or anything like that. It's just the general opioid crisis harms.
Awesome. Thank you, Sierra. Are there any other questions for Jordan or I, or other comments? Well, I'll just one more time then. I just want to give props to Jordan for all of his efforts in helping us do this, and all of those of you who jumped in and spoke to your policymakers and mobilized your coalitions. I think that's a big reason why we were able to get this money dedicated specifically to primary prevention at the local level, which, as we know, very often is ignored. So I think this could be a game changer for us. And if we can get some really good results, I think we've got a good chance of convincing them to continue dedicating a portion of these funds to preventing problems before they occur.
Awesome. Thank you so much, Logan and Jordan. That was great, really great information. And we'll make sure to send all the chat links and everything out with our recording today. Before we end, does anyone have any other questions for any of our presenters? Okay. Well, if you think of anything, feel free to reach out. Remember that we have a Facebook page that's always available for folks to be able to ask questions or post coalition success stories or ask for advice. Well, I can't think of anything else either. So without further ado, I'll let you guys go. And thank you so much for coming today. And thanks to all our presenters, and hopefully see most of you guys out at Bryce next month. Bye. Thank you.